Hello guys, today we're going to talk about the carcinoma in situ. So this is like the pre-malignant lesion that occur right before the stages of the cancer. So this is also known as stage of zero cancer, as they occur right before the stages of cancer. So this carcinoma in situ occur right before the stages of the cancer. So it is also known as stage of zero cancer. So carcinoma in situ eventually turn into the cancer cells. It is also known as non-invasive, as there is no migration or invasion to the other tissues or organs, so it is known as non-invasive. Also known as pre-invasive, although there is no invasion in carcinoma in situ, but after carcinoma in situ, this eventually turn into the invasive cancer, so it is known as pre-invasive cancer. So in this video, we'll be talking about the carcinoma in situ of oral cavity. Although it is more common in other body parts or organs, but we'll be focusing more on the carcinoma in situ of oral cavity. So we'll be discussing about its clinical features, histological features, as well as some treatments. So you can see in the picture, there's a mutation in only one cell, and it undergoes hyperplasia. That is, the numbers of the cells increase rapidly as time goes. This hyperplasia eventually turn into the carcinoma in situ. So you can see the whole of the epithelium is being affected here, and this stage is called carcinoma in situ. So after this stage, it eventually turn into the cancer cell. So if you're new in this channel, please like and subscribe. That would be highly appreciated. So let's get started with the definition. So it is defined as it is the spreading intraepithelial type of superficial carcinoma, which mostly occur over the skin and sometimes mucous membrane, including that of oral cavity. So this is the spreading type of intraepithelial carcinoma. Intraepithelial carcinoma means that occur within the epithelium. So here is the epithelium, and this carcinoma in situ spread within this epithelium, within this area. So it does not spread to the other parts or organ, but it's spread within this epithelium. So that is the intraepithelium, and they become more dysplastic and eventually turn into the carcinoma in situ. So they spread within this area. So it is known as intraepithelial spreading, and it mostly occur in the skin and sometimes mucous membrane. So mucous membrane are the lining cavities of the respiratory tract or GI tract or urinary tract, and including that of oral cavity. So in the video, we'll be focusing more on the carcinoma in situ of oral cavity, although it is more common in the other organs and body parts. Also, it is the most severe stages of epithelial dysplasia, which involves the entire thickness of epithelium. However, the basement membrane remain intact. So this is the last stages of epithelial dysplasia. So epithelial dysplasia means the shape, sizes, and colors of the epithelium changes. So here in the picture, there is one mutation of cells, and this eventually turn into more cells, more invasion, so they undergoes hyperplasia, and eventually the whole of the epithelium is affected. As you can see, the whole of the epithelium, they are turned into different cells from their normal cells. So this layer, this layer, this layer, whole layer get affected, and this stage is called carcinoma in situ. So this is the last stages of the epithelial dysplasia. So after this stage, this eventually turn into the cancer cells. So this is the last stages of the carcinoma. This is the last stage of the epithelial dysplasia, where whole of the epithelium get affected. However, the basement membrane remain intact. So although the whole of the epithelium remain, I mean, get affected, but the basement membrane does not get affected at all. That's why they cannot migrate, because this basement membrane act as a capsule. Let's see the clinical features. So it mostly occur in the elderly people, and if you see the sex, it is more common in males, as male are more involved in the smoking or drinking or any bad habits. Also, sites, it mostly occur in the intraoral sites, all intraoral site, but the most common areas are the floor of the mouth, tongue, and lips, And let's see the presentation. This lesion appear either as a white plaque or as ulcerated or as a red area over oral mucosa. So this lesion could either appear as a white plaques, or there may be ulcers, or also there may be red areas in the oral cavity. And also the lesion may sometimes clinically appear as a leukoplakia or erythroplakia. So this lesion also sometimes appear either as a leukoplakia or erythroplakia. And metastasis is not possible as the basement membrane remain unaffected. So metastasis is not possible because the basement membrane could act as a capsule. So that's why metastasis is not possible. Let's see the histological features of carcinoma in situ. So in carcinoma in situ, hyperkeratosis may or may not be present on the surface of the lesion, and if it is present, it is usually hyperparakeratosis. So this hyperparakeratosis is the condition where there is keratosis but the nucleus is still retained, that is, nucleus is still present. And also the individual cell keratinization or epithelial or keratin pulse are rare. So there is no individual cell keratinization or keratin pulse formation in carcinoma in situ, as you can see in the picture. Also, epithelium is generally hyperplastic or sometimes can be atrophic. So the epithelium size, shapes or color changes and become hyperplastic, or also there can be atrophied. Also there is a loss of orientation. So if you see the cells and the shape of the epithelium, they are usually different from the normal shape and structure. And also there is an increase in nuclear cytoplasmic ratio. So if you see some of the cells, the cytoplasm ratio has drastically decreased while the nuclear size has drastically increased. So this is the change in nuclear cytoplasmic ratio. Normally the nuclear size is small while cytoplasmic size is large, but it changes in carcinoma in situ. Also there is a nuclear hyperchromatism, so the chromatin is increased and it become more dark, as in some cells are more dark, the nuclear become hyperchromatism. Also there is abnormal mitotic figure, so the mitotic activities of the cell is increased. And also there is a loss of intraepithelial adhesion. So you can see the picture, there is gaps between the cell, as in here. Normally they are tightly packed, but in carcinoma in situ the adhesion is lost and they become loose and start to apart from each other. So the treatment of the carcinoma in situ is mostly done by the surgical excision, as carcinoma in situ can turn into any types of the cancers. So most commonly they are treated by surgical excision. The whole of the area is excised, and also it could be treated with radiotherapy, and also cauterization, where electrocautery is used to treat the carcinoma in situ. Or also it can be exposed to the solid carbon dioxide, where the carcinoma in situ is frozen by using carbon dioxide, and it is excised.